Today we will discuss about oncology. What is oncology? Oncology department का नाम तो सुना है ना? It is related to malignancy. Questions will be asked like, what are the common cancers? What is natural history? What is presentation? What is the cause of the disease? What are the complications and cause of death of common cancers? कौन कौन सी common cancers होते हैं? तो नंबर 1, 1, 2. कौन कौन सी common malignancies होती है? What is cancer? Definition of it. Cancer is a disease in which some of the body cells grow uncontrollably and spread to other parts of the body. It can start almost anywhere in the human body, which is made up of trillions of cells. Normally, human cells grow and multiply through a process called cell division to form new cells as the body needs them. When cells grow old or become damaged, they die and new cells take their place. What is apoptosis? वर्ड सुना होगा ना आप लोगों ने पैथोलॉजी में. What is apoptosis? प्रोग्राम सेल डेथ. यदि वो नहीं होगी तो क्या होगा? It will result into multiplication of cells and it results in malignancy. Sometimes this orderly process breaks down and abnormal or damaged cells grow and multiply when they shouldn't. These cells may form tumors, which are lumps of tissues. Tumors can be cancerous or not cancerous. Not cancerous means it may be benign. Estimated number of people living with the disease around 2.25 million. Every year, new cancer patients registered over 11,57,294. Cancer-related deaths 7,84,821. Risk of developing cancer before the age of 75 years in males it is 9.181% and in females it is 9.42%. 9.42 बोलते हैं 9.42 बोलते हैं 42. First is breast cancer. It arises in the lining cells, that is epithelium of the duct, in 85% or lobules in 15% in the glandular tissues of the breast. Initially, the cancerous growth is confined to the duct or lobule, where it generally causes no symptoms and has minimal potential for spread, that is metastasis. सर्जरी में पढ़ रहे हो ना आप लोग ये, इसलिए जो आपके सर्जरी कोर्स में है और पैथोलॉजी में जो चल रहा है उसी के रिलेटेड होगा. ओवर टाइम आप लोग थर्ड ईयर वाले हो ना, फाइनल ईयर फर्स्ट. ओवर टाइम these in situ, that is stage 0 cancers may progress and invade the surrounding breast tissues. Invasive breast cancer then spreads to the nearby lymph nodes, regional metastasis, or to other organs in the body, distant metastasis. What is regional metastasis? Breast वाले कार्सिनोम कहाँ पे होगी regional metastasis? What are the lymph nodes? Axillary lymph nodes. And distant metastasis, it may to bone, brain, and in blood. If a woman dies from breast cancer, it is because of widespread metastasis. Approximately half of breast cancers develop in women who have no identifiable breast cancer risk factors other than gender and age, over 40 years and in females. Certain factors increases the risk of breast cancers, including increasing age, obesity, harmful use of alcohol, family history of breast cancer, history of radiation exposure, reproductive history, that is such as age that menstrual periods began and age at the first pregnancy. Tobacco use and postmenopausal hormone therapy. Generally, symptoms of breast cancer includes a breast lump or thickening, alteration in size, shape, or appearance of a breast, dimpling, redness, pitting, or other alterations in the skin, changes in the nipple appearance or alteration in the skin surrounding the nipple, abnormal nipple discharge. Cause of death in breast cancer. In exam they may ask what are the causes of death in breast cancer malignancy. First is metastasis to different organs like lung, brain, genitourinary tract and cardiovascular system. Most of malignancy कहाँ होती है? From breast. पीजी एंट्रांस की पढ़ रहे हो ना आप लोग. This is the site of most common metastasis in breast cancer. पैथोलॉजी पढ़ा होगा आप लोग. कोई पढ़ रहा है उसकी प्री पीजी की एंट्रेंस की प्रिपरेशन करते हो ना आप लोग? अच्छा, ये कहाँ पढ़ते हो? किसी को नहीं पता. नेक्स्ट इज पल्मोनरी इनसफिशियंसी, इन्फेक्शन, कार्डियक डिजीज और सीएनएस डिजीज. नेक्स्ट इज लंग कैंसर. It is the most common cancer. It kills 1.76 million people every year. In India, with a mortality rate 5 per lakh, it is responsible for 63,475 deaths annually. मोर्टिलिटी रेट तो पढ़ा हुआ ना आप लोगों ने. व्हाट इज मोर्टिलिटी रेट? पीएसआई में ना, पीएसआई चल रहा है ना. व्हाट इज मोर्टिलिटी रेट? रोल नंबर 44. मोर्टिलिटी रेट नंबर ऑफ कहाँ पे? 1000 कौन सी पॉपुलेशन? हो गया कवर हो गया टॉपिक ये. पढ़ ली ना कुछ टॉपिक को नहीं पढ़ेंगे. एनआरआर क्या होती है? नेट रिप्रोडक्टिव रेट. और रेट कौन है? 48. नेट रिप्रोडक्टिव रेट क्या होती है? 136 कौन है? 136. इंसिडेंस क्या होता है? व्हाट इज इंसिडेंस? पीएसएम तो जरा आपको मेलिग्नेंसीज में सब पता होना चाहिए. व्हाट इज इंसिडेंस पढ़ रहे हो ना. इंसिडेंस इतना है, मोर्टिलिटी इतनी है, प्रिवेलेंस इतना है. व्हाट इज इंसिडेंस? आपको पता ही नहीं इंसिडेंस क्या चीज़ है तो क्या करेंगे. रोल नंबर 1111. व्हाट इज इंसिडेंस? इंसिडेंस नहीं पता. 52. नंबर ऑफ न्यू केसेस. आप लोग पीएसएम पढ़ रहे हो, मुझे पढ़े कितने साल हो गए. तो स्पेसिफिक पॉपुलेशन होती है ना. प्रिवेलेंस क्या होती है नेक्स्ट? व्हाट इज प्रिवेलेंस? मैडम न्यू केसेस कहाँ पे? तुम लोग आधी दूरी डेफिनेशन बता दो बेटो. There are two main forms of primary lung cancer. These are classified by the in India with a mortality rate out of 27 population-based cancer registry, 10 in the country have recorded lung carcinoma is the most common cancer in the males. In males, it is the most common cancer with 10.4%, and in females it stands at 7th place. आप लोग क्वेश्चन आता है which is the most common cancer in males, which is the most common in females, which is the most common cancer. ये आप लोग एंट्रेंस क्वेश्चन आते तीनों के आंसर अलग अलग हैं. There are two main forms of primary lung cancer. These are classified by the type of cells in which the cancer starts growing. They are: first is non-small cell lung carcinoma, second is small cell lung carcinoma. What is non-small cell lung carcinoma? It is the most common form, accounting for more than 87% of cases. It can be one of three types: squamous cell carcinoma, adenocarcinoma, or large cell carcinoma. Non-small cell means it won't be small cell. Small cell different है, non-small cell different है. Non-small cell squamous आ गया, adenocarcinoma, large cell carcinoma. Small cell carcinoma is a less common form that usually spreads faster than non-small cell lung cancer. Symptoms of lung carcinoma: cough around 8 to 75%, weight loss 68%, dyspnea 3 to 60%, chest pain 20 to 45%, hemoptysis, bone pain, clubbing, fever, and SVC obstruction. What is SVC? Superior vena cava obstruction. Clinical findings suggestive of metastatic disease. First is symptom: weight loss more than 10 pounds, musculoskeletal pain, headache, syncope, extremity weakness, seizures. What are the signs? Lymphadenopathy, hoarseness of voice, SVC syndrome, bone tenderness, focal neurological signs, and soft tissue mass. Why there will be focal neurological signs? Roll number 7. पेशेंट है कार्सिनोमा लंग का. सिम्टम साइंस में आप पढ़ रहे हो फोकल न्यूरोलॉजिकल साइंस. वाई पॉसिबिलिटी है क्या लंग कार्सिनोमा न्यूरोलॉजिकल साइंस हो सकता है? इज इट पॉसिबल? रोल नंबर 98. सिंपल चीज है. लंग कार्सिनोमा वहां से ब्लड से कहाँ से जाएगा? लंग से. बात ही बता सकते हो कोई? नहीं, स्टार्टिंग में लंग से कौन से स्प्रेड होगा? राइट में जाएगी सिस्टम मेटास्टेसिस हो सकती है, तो ब्रेन में जाके कुछ नहीं कर सकता। ठीक है, तो बेसिक है। What are the causes of death in lung carcinoma? First is infection, either sepsis or pneumonia, cardiac involvement, hemopericardium and myocardial metastasis, liver and brain metastasis, pulmonary hemorrhage, pulmonary embolism and respiratory failure. Next is prostate cancer. Incidence rate of prostate cancer is, इंसिडेंस रेट होती है, रेशियो होता है? 1:1 कौन है? रेशियो का एग्जाम्पल क्या है? ये सब भी नहीं पता किस लोगों में, ये सेंसोग्राफ रेशियो बोलते मेडिसिन में नहीं आता। इंसिडेंस ऑफ प्रोस्टेट कैंसर इज 9 to 10 per 1 lakh population. Prostate cancer incidence and mortality rates are strongly related to the age, with the highest incidence being seen in the elderly men more than 65 years of age. African Americans may have the highest incidence rates and more aggressive types of prostate cancer compared to white. What are the symptoms? Terrible urinating means difficulty in micturition, decreased force in the stream of urine, blood in the urine, that is hematuria, blood in the semen, bone pain, losing weight without trying, erectile dysfunction. What is significant weight loss? Decreased symptoms है ना, losing weight without trying. Significant weight loss, that is unintentional weight loss. About 80% of the time prostate cancer cells metastasize or spread. They will spread to bones such as the hip, spine and pelvic bones. Presents with bone pain, pathological fractures and compressive neuropathy of spine. Okay. This was